Welcome back to the Caregivers Careport, where we're here to support family caregivers and the people who care about them. I'm Dr. Corabell Arps, your guide through today's episode focused on the intricacies of navigating your way through the healthcare systems that you encounter and use. This can be a daunting and complex challenge on many levels. There are multiple levels of interactions, including the providers, health systems which operate under legal and institutional regulations and ethical considerations, privacy laws, insurance coverage and billing, patient rights, your rights as a caregiver, and communication between all involved parties. And at times, you may even be dealing with providers and health organizations which are new to you and may seem different in some ways. Dealing with the systems that impact your loved one's health care needs really can be stressful, but knowledge and preparation can greatly ease the confusion and uncertainty, reduce your stress, which is good for your health, and help you ensure the best possible care for your loved one. So we'll cover a lot in this overview of how you can be a more confident and less stressed caregiver and really successfully optimize your loved one's care when utilizing complex medical systems. So let's begin with the important foundation, which is understanding your loved one's medical needs and treatment plan. It's crucial to not only comprehend their diagnosis and prescribe treatments, but also to really grasp the broader context of their healthcare journey and what the goals are in treatment. This means familiarizing yourself with their medical history, including any previous treatments, surgeries, medications, and allergies, and knowing both the short-term and the long-term goals of their treatment and the various interventions being used to reach their treatment goals. It means keeping an updated medical journal, and that can be immensely helpful in tracking their symptoms, medication changes, and doctor's appointments. And I strongly recommend having a healthcare information binder for your loved one. It takes a little bit to set it up, but you will be so glad you have it once it's set up and you're using it. And the binder would include sections on their medical history with their diagnoses, past and current treatments, surgeries, and test results, a list of their current and past providers' names and phone numbers, and a current list of medications. Also, build a section for copies of the fronts and backs of insurance cards, and possibly the insurance booklet listing their coverage or the digital links for accessing that information. Also include a section with copies of pertinent legal documents such as medical power of attorney and any advance directives. If your loved one is living in a care facility, add a section for the names and phone numbers of providers, relevant office staff, and administrators of that facility. And then next, let's talk about communication and the management of personal health information. Effective communication with healthcare providers is really essential for ensuring your loved one receives the best possible care. And this involves asking questions, expressing concerns, and actively participating in care decisions. Don't hesitate to seek clarification if something is unclear, and consider bringing a list of questions or concerns to appointments to ensure nothing is overlooked. When accessing care, you will bump up against privacy laws, which regulate the sharing of healthcare information, and this is a really big topic. There are many regulations regarding privacy and the exchange of healthcare information. Healthcare privacy laws, such as the Health Insurance Portability and Accountability Act, which is usually just called HIPAA in the United States, are designed to protect the privacy and confidentiality of individuals' health information. Now, these laws establish standards for the use and disclosure of protected private health information by healthcare providers, health insurance plans, pharmacies, and other entities that handle medical records. So, what does this mean for you when you accompany your loved one to the doctor's office or hospital or to any health appointment? Well, first and foremost, it's important to understand that healthcare privacy laws generally prohibit healthcare providers from disclosing a patient's medical information to anyone other than the patient, unless they have the patient's consent. This includes giving information to family members, caregivers, and other individuals involved in the patient's care. However, there are some exceptions to this rule. For example, healthcare providers may share medical information with family members or caregivers if the patient has given their explicit consent or if the disclosure is necessary to provide the patient with appropriate medical care. So, in emergency situations where the patient is unable to provide consent and immediate medical treatment is necessary, healthcare providers may disclose limited medical information to caregivers in order to provide appropriate care. However, such disclosures are typically limited to information that is directly relevant to the emergency situation. So let's talk about a medical power of attorney, which is linked to release of private health information and decision-making about the care of the individual. Now, I'm not an attorney and can't give legal advice, but I want to talk with you in general about having a medical power of attorney and what family caregivers need to know about it. Now, a medical power of attorney is also known as a healthcare proxy or healthcare power of attorney, is a legal document that allows an individual, who's known as the principal, to appoint another person, known as the agent or proxy, to make medical decisions on their behalf if they become unable to do so themselves. This includes decisions about diagnostic tests, medications, surgeries, therapies, and other medical interventions. In addition to medical treatment decisions, family caregivers with a medical power of attorney may also be responsible for making decisions about end-of-life care. This can include decisions about life-sustaining treatments, palliative care, hospice care, and other aspects of end-of-life planning. The caregiver who holds a medical power of attorney for their care recipient is typically considered a personal representative of the care recipient for purposes of accessing their medical information and making decisions. And this means that the caregiver has the legal authority to access, request, and receive the care recipient's medical records and information from healthcare providers. But also, healthcare providers may still exercise discretion when sharing medical information with caregivers, particularly if they have concerns about the caregiver's ability to make decisions in the care recipient's best interests. And providers may request documentation of the caregiver's legal authority, such as a copy of the medical power of attorney document, before disclosing sensitive information. And that's when having the binder is really helpful, because anytime you go to an appointment or access services in a healthcare system, if you just take the binder, you'll have all of that with you and won't be having to rummage through drawers looking for it before going to the emergency room. Now, it's crucial to understand your role and responsibilities if you've been named as an agent in a medical power of attorney document, because it is a big responsibility. And it's also important to know that the caregiver's authority is not unlimited. Healthcare privacy laws require caregivers to act in accordance with the care recipient's wishes and best interest when accessing or disclosing their medical information. And caregivers must also adhere to any limitations or conditions that were specified in the medical power of attorney document itself. So you should be familiar with what's in that document. You should familiarize yourself with the specific powers and limitations outlined in the document, and this may include understanding any preferences or instructions that the principal has provided regarding their healthcare decisions, the decisions that you're going to be making for them, as well as any conditions or circumstances under which the document becomes effective. This is another reason why communication is so important. It's essential to maintain open and honest communication with the principal, as well as other family members and healthcare providers regarding the medical power of attorney arrangement. This includes discussing the principal's wishes and preferences for their own care, as well as any changes or updates to their healthcare directives. Now, if your loved one has dementia, it is helpful, if possible, to discuss their wishes as early in the disease as possible while they're still able to have that conversation, especially if that discussion was never had before the onset of illness. In addition to medical treatment decisions, another important aspect of decision making for family caregivers with the medical power of attorney is advocating for the care recipient's overall well-being. This can involve coordinating care between different healthcare providers, ensuring the care recipient's medical needs are met, and advocating for appropriate support services and resources. There is a real need to stay informed and proactive in your advocating role. The caregiver, who is also the agent, may be responsible for making decisions about healthcare finances and insurance matters on behalf of the person receiving their care. This is one of the most daunting aspects of healthcare for many caregivers. Understand your loved one's insurance policy, including what services are covered, what copays or deductibles apply, and how to navigate the claims process. That's really vital. Take the time to review the insurance documents thoroughly and reach out to the insurance provider or a healthcare financial counselor for assistance if needed. This can include getting help for managing healthcare bills, navigating insurance coverage, and making decisions about long-term care options. Caregivers must exercise really sound judgment and act in the care recipient's best interest when managing these financial aspects of care. Family caregivers should also be aware of the legal requirements for executing and implementing a medical power of attorney document. And this may include ensuring that the document is properly signed, witnessed, and notarized in accordance with state laws. Consult with an attorney who specializes in elder law or healthcare law with questions or help getting a medical power of attorney. Finally, it's essential for family caregivers to understand the importance of having a backup plan in place. While serving as the agent in a medical power of attorney document is an important responsibility, life happens and unforeseen circumstances may arise that prevent you from fulfilling this role. So it's wise to designate an alternate agent or proxy who can step in if needed, if you're unable to act as the agent. I want to emphasize the significance of medical power of attorney for family caregivers. By understanding what it is, your role and responsibilities, and the importance of communication and planning, you can ensure that your loved one's healthcare wishes are respected and upheld, even in challenging circumstances and when they cannot make decisions for themselves. But beyond these things, it's essential to be aware of both your rights as a caregiver and your loved one's rights as a patient. In addition to understanding the privacy law and medical power of attorney as part of knowing your role, it's helpful to know the process for filing grievances or complaints if you feel that your loved one's care is being compromised. Don't hesitate to advocate for your loved one's needs and seek assistance from a patient advocate or healthcare ombudsman within the healthcare system you are using, if necessary. And finally, build a strong support network. Caregiving can be isolating, but you don't have to go through it alone. Reach out to family members, friends, and other caregivers for support and guidance. You might consider joining a support group or online community where you can connect with others who understand what you're going through and share resources and experiences. Explore what supports may be available to you through your doctor's office, your clinic, or the wider healthcare system that you use for yourself. As we wrap up today's episode, I want to leave you with one key takeaway. You are not alone in navigating the healthcare system as a family caregiver. Arm yourself with knowledge, advocate for your loved one's needs, and lean on your support network for guidance and encouragement. Yes, healthcare systems are big these days. They're complex and daunting, but their goal is to provide good care, and hopefully they are user-friendly and helpful. But if you feel like your loved one's needs are not being met despite your best efforts, speak up and request a patient advocate or someone within the facilities whose job it is to facilitate resolution. I hope this information is helpful to you, and if it is, click on the like button and subscribe to this channel. And if you would like to contact me to ask questions about this or other topics related to how you can reduce your stress and support your own health, click on the link below. I would love to hear from you. This is Dr. Corabell Arps, and until next time, take care.